Hi everybody, Stephanie from PDA Health. Hope you guys are having a fantastic day. So we've been having conversations last while surrounding head bandages. And one of the most concerning head bandages is where there is a scalp wound with or without severe bleeding on the crown area of the head. Now, a problem comes in with this is if you take a roller bandage and you actually bring it down over the chin, you are limiting the patient's breathing and the patient may be suffocated. There's a nice little technique that we can actually do to put the head bandage on, attaching the pressure pad on the open wound that I quickly want to show you guys. So, firstly we're going to take the normal pressure pad. We've done the whole history hazard help section of it. We've gotten permission from the patient. We have to examine the wound already. And we're going to just quickly get this bleeding under control. The patient is going to put direct pressure on the wound, on the top there. And we are going to take a normal triangular bandage folded into a pressure pad. I've got my gloves on. The patient is going to take the pressure pad and just hold it in place for us on the wound itself. Then I'm going to take two roller bandages. Now what you'll see, I'm using a bit more faded one so you guys can see the difference, and a bit more newer one so you can offset each other. I'm going to take the two roller bandages and I'm going to tie the two ends together. Simple knot, not any of these navy knots, so they're interlinked. Next step I'm going to do is I'm going to take this knot, I'm going to put it right here in this little, on a female patient, under the ponytail, when the little hollowness formed in the back of the skull, around about the cervical one attachment to the cranium, to the skull base. Both of these bandages are going to come around and meet, thank you, at the forehead. Now, I'm going to cross them over, not covering the patient's eyes. The bandage is going over the top. The bandage is going over the top. It's going to carry on going around. The one at the bottom, like this darker one, is going to start coming up and over. This is going to look a bit weird, but we're going to come around. And same situation in the back. So we're going to anchor, the bandage is coming around, it's going to anchor the one that's going over the top. The one that's going over the top is going to come back around, down to this point. My bright one is going to come around again and anchor over the top one. And we are going to carry on with this motion until the entire bandage at the top is sufficiently covered. We are going to move from side to side over the top the whole time. Now eventually this is going to start looking like a bit of a bandana, which is exactly what we want, because we want this bandage going over the top to sufficiently hold the pressure pad in place whilst not allowing any movement of the pressure pad at any point. This will limit the flow of blood out from underneath it. Just make sure that it is comfortably tight the whole time. Now I'm at the end of the over the top one, so I can just use a safety pin and attach it here. I'm just going to, for this purpose, tuck it in, and I can just use the one going around and around to just make sure that everything is held in place properly, and then I'm going to just safety pin it down. This bandage is great if you've got a bit of extra time to make sure that there's no bleeding that's going to come out. If it was to bleed through, I would fold another pressure pad, put it on top, and restart the process. That might take a little bit more bandages. However, it is the best way to actually control severe bleeding on a spot where you can't actually attach it around the head versus avoiding the choking elements. Anyway, that's it for today. Hope you guys have a great one. Cheers!